Hello, everybody, and welcome to the Tuesday edition of Video Clips, which is brought to you by Wellness Forum Health and the Wellness Forum Institute for Health Studies. Today, I'm going to talk about three things. I'm going to talk a little bit about evidence-based medicine and how it should work, laws that govern it, motivation for change, and then I'm going to respond to some viewers' requests that I cover continuous glucose monitors. So, first of all, announcements. Everybody loves free stuff, and we have something huge coming up that's free. It's our 3-day boot camp in March, the 14th, 15th, and 16th. It's 3 hours each of those evenings, including Thursday, Friday, Saturday night. We're going to cover so much stuff, and you're going to hear from successful people who've changed their lives. You're going to hear from some health professionals who've been through our programs. I can't wait for this. I'm so excited. Lots of information that I've not covered in any of the programs we offer yet, and then some stuff that I'll cover that we've already covered because you need to hear it again. Sometimes you just need to be reminded of stuff, right? Second thing, our clinic is open and you can come see our nurse practitioner if you live in Ohio. Many people are driving in from out of town to see her because finally a practitioner practicing in our model of healthcare. Very exciting. And so we had a reception for her on Saturday. The building was packed. I was so happy to see that. So that is a resource available to you if you live in Ohio. Last but not least, a lot of you have been asking when Dr. Carol Gifford, the veterinarian who spoke at our conference and who took care of Schroeder, my beloved cat, who died in 2022 for 3 years. She kept him alive after he was given a death sentence with kidney disease. She's going to present a two-part workshop on May 4th on dog and cat vaccines. She's so thorough. Love this woman. Everybody who meets her loves her. She loves animals, and she is a very thoughtful and incredibly qualified practitioner who uses lots of modalities to help animals. So you guys asked for more programming. This will be the first of more programming. All right, so let's talk about evidence-based medicine and behavior change and a whole lot of things related to this new model of healthcare. So let me start by saying clinical care accounts for about 20% of health outcomes. The rest is health behaviors and social determinants of health, but we spend all the money on the clinical care and the outcomes are terrible. Our current healthcare system costs the United States $4.5 trillion a year, most of it funded by government subsidies. And of course, we're not going to have access to these subsidies in our own system, which means we're going to have to focus on two things: health-related behavior change and also evidence-based decision making. Now, this is the part of this I want to cover first because there's confusion. Some people are concerned that this will involve rationing or dictating what people can and can't have in order to rein in costs. Not at all, and you don't have to do that if you do it right. Evidence-based decision making means that in cases where a patient asks for something or a practitioner recommends it, then the person is provided with evidence, written evidence describing risks and benefits. And isn't that the way it should be, really? So let's take an example. Let's say that you request a colonoscopy from a practitioner in our system. An information sheet would be provided, which includes facts such as the only study evaluating outcomes after colonoscopy wasn't completed until October of 2022. It showed that colonoscopy didn't reduce the risk of colorectal cancer, death from colorectal cancer, or all-cause mortality. There are risks, including tears to the lining of the colon. Sometimes that can be fatal. The information sheet would discuss risk factors for reducing the risk of colorectal cancer and how you could do that without anything invasive. It would also contain some information about alternatives such as fecal immunochemical test or sigmoidoscopy, which is considerably less invasive, if anything invasive is warranted at all. The patient, you, would then choose, and your choice would be respected, but only after a thorough discussion is had. By the way, you may not know this, but it's required by law that this type of information be provided to patients before they opt in or out of any health protocol, including the option to do nothing and what the consequences would be. The law is not followed, and health outcomes and the cost of healthcare are atrocious as a result of it, in part due to just lack of informed consent. So the issue isn't to dictate what you can and can't do. The issue is to make sure that you're making decisions based on facts. And what we know from our experience is that when people are presented with accurate factual information, they consume less healthcare. So let's focus on what all the focus should be on, which is the behavioral side. diet, hydration, exercise, weight loss, etc. Again, you have to provide people with evidence so they can make intelligent decisions. But there's another issue I think we should talk about concerning behavior, and that's helping people to identify why they want to be healthy, or conversely, why they're not making a commitment to be healthy. It's easy to explain the benefits of plant based eating or exercise or weight loss and better sleep. I mean, people understand that stuff pretty well. But getting to the why or the why not involves digging a little deeper. And you have to ask questions, and you should ask these questions of yourself. Like, what does health mean to you? Why do you want to be healthy? Or why aren't you making this a priority at this time? What is important to you? What do you find motivating? What needs to change in order for you to act on your desire to be healthy? And just, we're going to talk about this at the boot camp, but just something to think about between now and then is, why are you postponing it? If you are postponing getting yourself in great shape, and what are the consequences of postponing, thinking I'll get to it someday? And if you've been postponing it for a long time, you may be starting to figure out that you're not getting to it someday, that getting to it now might be the thing to do. But I think we can all agree that there's no real opportunity in a conventional medical setting to have conversations like this. But I think feeling inspired and empowered are really important tools for health improvement. And again, as I mentioned, we're going to talk about some of that at the March boot camp, how to get in touch with your why. And I want people to walk away thinking, this is the year I'm going to do it. And I'm going to share some personal things with you about my own journey in this way, and also some things I'm doing right now that are not health related, but I can share with you some of what I have postponed and I'm taking action on that might help you to identify some of your obstacles as well. So anyway, we'll have some very great conversations, insightful conversations, the group of us in March. I'm so looking forward to that, those big blocks of time, because in situations like this, I think I provide really good information, but I got to do it in 10 or 20 minutes, so I don't have an opportunity to get into anything too terribly deep here. So really looking forward to that opportunity. Um, Another thing I wanted to announce for people who are professional members or above, the two workshops coming up in March. One's going to be on magnesium, the supplement everybody claims is magical. Going to give you some factual information about that and the things you should know series. And then we're going to cover a really interesting psychiatry book, or a book about psychiatry, called The Great Pretenders, I think, or something like that. But it's about the Rosenhands experiment, where healthy people were sent into mental institutions posing as unhealthy, as mentally ill people, and what happened. It's a pretty incredible book and a pretty incredible story of what happened. All right, so now to the continuous glucose monitors. 3 or 4 people have emailed me just in the last couple of weeks and asked me to talk about it. And so the reason it's coming up for discussion is that they're being recommended for everybody now. So it used to be just type 1 diabetics were told to use them. And even then, there's some questions about their utility. But anyway, let's just start at the beginning with basics. CGMs, or continuous glucose monitors, are small wearable devices that provide continuous data on blood glucose levels. They're typically worn on the arm or the abdomen. Rather than requiring frequent puncture of the skin, the CGM measures glucose in the interstitial fluid, the fluid that is between the body tissues. The data collected is sent to a device like a smartphone or a watch, or in the case of a type 1 diabetic, perhaps to an insulin pump, every 5 minutes or 288 times per day. At one time, as I mentioned, the devices were pretty much recommended for type 1 diabetics who do require frequent monitoring. Use gradually expanded to type 2 diabetics, and of course, you've seen this before, you make a whole lot more money if you can increase the audience of people using a particular thing, right? So, and now they're being recommended for healthy people who want to track their biomarkers constantly. The argument is that glucose fluctuations are harmful, and if monitored, you could stop them. Well, I don't think this is a very good idea. In fact, it's a terrible idea. First of all, there is no convincing evidence that constant tracking of anything makes anyone healthier. In fact, there's very considerable research showing that the fitness trackers for heart rate and calories expended during exercise, they don't have any positive impact. And some studies show the effect is negative. And I think one of the reasons is because it's focused on all the wrong things. I mean, I can put in steps walking around my great big office all day long, but that doesn't make me any more fit at the end of the day because I don't expend enough energy doing it. So anyway, I don't want to get too far into that, but let's go back to the CGMs. All right. First, just because you can measure something doesn't mean that you should. One of the problems with healthcare is we're looking harder and harder for less and less significant abnormalities. We find them, but it doesn't benefit people. For example, hunting for skin cancer has resulted in finding abnormal spots on almost everybody, but we have to remove 4,000 of them to prevent one melanoma death. That's a whole lot of people getting treatment for nothing. Blood tests are incredibly comprehensive these days, often dozens of pages showing all kinds of minor abnormalities and markers that people don't even know what they are. This makes people nervous, and of course, there are solutions for any abnormality, usually drugs or supplements or both, depending on which disease-mongering health professional you're seeing at a particular time. This approach makes medical centers and drug and device makers and supplement makers and some practitioners rich. It does not, however, make Americans healthier. For the record, when you eat, your glucose levels rise and insulin levels rise too in order to escort glucose and fat into the cells. This is normal, and attempts to pathologize it are insane. Most people don't know that there is no formal and recognized medical definition of what constitutes a blood sugar spike in normal people. This allows the disease mongers to make up guidelines based on their own preferences, which generate income from endless appointments and sales of stuff to address the conditions they make up, like prediabetes, which is not a real condition. In fact, there's a pre-everything now, which is just another way of expanding the market for whatever it is these people are selling, natural, pharmaceutical, or otherwise, a way to herd people into a system of treatment. Furthermore, the unwarranted constant monitoring distracts from what really makes people healthier. Focusing on dietary pattern, the food choices, exercise, reducing alcohol intake, weight status, psychological state. These are much better investments of time and energy, and they cost a whole lot less money. And therein is the problem. They're not expensive. You can't become a bazillionaire focusing on this stuff like you can selling treatments from the pharmaceutical industry, supplement industry, etc. There's just more money in doing the wrong thing, unfortunately. But you can do the right thing because the purpose for what you should be focused on is your health, not making other people wealthy. So hopefully, message received, right? Okay, if you're interested in the boot camp or the pet vaccine workshop or any of the things I'm talking about, my email address is pampopper@msn.com. As usual, pass this on to anybody who you think would enjoy watching it, and I will be back to you on Thursday with more news.